I'm John Sheffield, and I'm the program director of the allopathic part of our program here at the Reading Hospital Family Medicine Residency Program.
My name is Dr. Amy Lua, and I am the program director for the osteopathic portion of Reading Hospital's Family Medicine Residency Program.
The Reading Hospital Family Medicine Residency Program has been in existence for about 48 years now. 3 years is an exceedingly short amount of time to learn all the things that you need to know to be a top-notch family physician. And as humans, we largely learn by pattern recognition. And so there is really no substitute for patient volume. And again, we are a 700 plus bed hospital.
It speaks volumes to know that Reading Hospital's emergency room is one of the busiest emergency rooms in the state of Pennsylvania, and one of the busiest also in the country. And so obviously when you have that volume of patients coming through, you're going to have a very full hospital. Our inpatient service tends to be very busy, very full. And so you get that volume that you need.
We really commit to broad spectrum training in our program. You don't want to have gaps in your training where at the time of graduation, there are doors that are closed for you. Be it internal medicine, be it hospital medicine, be it community medicine, be it newborn nursery, be it women's health and obstetrics. We want to keep all those doors open for our residents.
Every one of our faculty members is 100% dedicated to teaching. Year after year, when we talk to residents at the end of the year for their reviews, they give us that feedback that they genuinely feel the passion that all of us faculty have for teaching. We're working at a very state-of-the-art institution. We have a lot of resources that we can use to not only train our residents, but also for us to learn and to stay current with current technology, the ever-changing guidelines.
I kind of like to use the word bulletproof, sometimes because there's no clinical situation that our residents can't handle.
Every day brings something different, and so the way we have our schedules, some of our rotations could be for 1 week, for 2 weeks. They could then go into the office for a week or 2 weeks back to back every day.
We call it our X plus Y structure for scheduling. And what that means is that when our residents are out on rotation, say on cardiology or orthopedics, for instance, they are able to 100% immerse themselves in that experience. The Family Healthcare Center curriculum, it simulates real life, and you want your training to be like real life. So our residents will have back to back clinic sessions. And so not only do you learn the clinical medicine, you learn the survival skills and the efficiencies that you're going to need to know when you're out in your own practice.
Research and scholarly activity is definitely a big focus for us. We see that as a big part of what we call our pursuit of excellence. And we're fortunate enough to have been able to develop the Hannah Research Center for Primary Care, which is a really big benefit for our residents, knowing that it is dedicated to primary care research, which can be very different from other aspects of research. And so those that are interested can get heavily involved in that. We do quite a bit of research in population health. We have this joint venture with Drexel Medical School, and that has already brought a lot of opportunities, and we know it's only going to bring more. And I think that exciting opportunity will directly reflect to the residents as well. So training opportunities to teach medical students.
When our residents come to our program, we want them to buy into our model of collaborative education, where we are all teaching each other all of the time. I think the West Reading area is actually a rather unique place to be doing residency because it's actually quite diverse. On the one hand, we are here at Reading Hospital in West Reading, which is on the border of Wyomissing, which is a rather upscale community.
Whether you enjoy the outdoors, the arts, sports, shopping, whatever it is, our area has it, and the cost of living is exceptional.
If you drive 20 minutes west, you're in the middle of rural Pennsylvania with cornfields. If you drive 20 minutes east, you're very quickly beginning to feel like you're in distant Philadelphia suburbs. It really has something for everybody.
Part of our patient population being so diverse, our residents have access to translators for whatever language our patients speak. And it's really great because our translator services can be easily accessible either in person, over Vocera, other unique activities. So we have a global health track that our residents can get involved in, where we look at global medicine, not just here in the United States, but beyond. And so that's kind of a growing interest, and it's something that I think that we do very well. And we do mission work in the Dominican Republic, and we've done mission work elsewhere. But it's another added experience in addition to the unique addiction medicine experience that our residents have access to. So they're able to get more medical therapy training.
The Reading Hospital Family Medicine Residency is really a special place. We are looking for residents who want to come to our program to be the best. Our faculty, our staff, all of us are going to be right behind you all the way. Along with that hard work, we are going to really seek a balance with regard to your wellness as well. And again, we're going to work hard, but we're going to try to have a lot of fun doing it as well.